Alright, cool. So this is, well, first and foremost, today's discussion is going to be on the heart, which is one of the body's most important organs, and secondary to the brain.
I have the new
so this here is the heart. It's essentially a dungeon that has about 4 different chambers in it. And when we look at the heart, what we want to do is immediately orient ourselves with the heart with the apex facing down and towards the left. So when we're looking at it from an anterior perspective, there's 2 auricles at the top, and those auricles are known as atria, and then down here on the inferior portion are ventricles. Sitting superficially, we're looking at the pulmonary trunk, the aorta, and a variety of other vasculature vessels here. So briefly, if we're going to discuss blood flow throughout the heart, on the anterior side of the auricles, we're looking at pectinate muscles that would innervate into the atria. So blood flow, let's discuss that. Blood that's going to be draining from the upper extremities, from the head and the neck muscles, are going to go into what's called the superior vena cava, into the right atrium. Other vessels that are going to go into the right atrium would be the inferior vena cava. And if we look on the inside, there's another opening. 3 other things aside from the superior vena cava are going to enter into this chamber, which are the inferior vena cava, this here opening, which is on the back side of the heart. It's called the coronary sinus. And then also, if we put this back on here, we have one more vessel that's not a part of coronary flow, which is the anterior cardiac vein, or the ACV. All 4 of these are going to drain blood, deoxygenated blood specifically, into the right atrium, and then via a electrical impulse or a conduction of a SA node initiation, contraction of blood pressure from the right atrium into the right ventricle is then going to take place. Blood will then swell up inside of this here right ventricle and will propel itself through the pulmonary semilunar valve into the pulmonary trunk. That deoxygenated blood is going to go through the pulmonary trunk into the pulmonary arteries, which, by the way, are the only arteries carrying deoxygenated blood, into the pulmonary circuit, where it will then oxygenate itself at the respiratory membrane and then go through the pulmonary veins back into the left atrium. When that blood goes into the left atrium, this here is the left atrium. This is difficult to take off, but this is the left atrium. It's lined with simple squamous epithelium known as endocardium. And when that blood pressure fills up in the left atrium, it will then contract and go through this here valve, and this valve is the bicuspid valve. This valve on the right side ventricle is known as the tricuspid, and this valve on the left side is known as the bicuspid, or the left AV node, or the mitral valve. The mitral valve is attached to the left ventricle via papillary muscles, and those papillary muscles are innervated by Purkinje fibers. This side is the thickest part of the heart. It's the left ventricle, and those Purkinje fibers will lead into a different type of muscle group for the left ventricle, and that muscle type is known as trabeculae carne, which is a different type of muscle from the atrium, which we saw pectinate muscles or musculae pectinae. The trabeculae carne is a different, much more thicker type of muscle, and has a different regard with respect to function from that muscle. It's the thicker portion of the heart because this is the side that we will need to push out a stronger impulse in order to propel that blood throughout all of the systemic circuit. So the blood from the left ventricle will then go through this here valve opening right there, and that's known as the aortic semilunar valve. Blood will then go into the aortic semilunar valve and then go into the aorta, up the ascending aorta, and into these 3 trunks here. Following and going behind the posterior side of the heart, it will then go into what's known as the thoracic aorta, and then if it goes beneath the diaphragm, it's known as the abdominal aorta. Those 3 trunks, we'll talk about the branches later, but the 3 trunks up here, this is known as the brachiocephalic trunk, and off of it comes the carotid and the subclavian. This here is the left common carotid, and this here is the left subclavian, innervating the left side of the extremities. So once again, we have 2 atria, 2 ventricles, separated by a fine line which is known as the interventricular septum. The blood, the heart is actually selfish in the fact that it will take the best blood for itself. And that blood is going to go into coronary flow before it enters into systemic circulation via the right and left coronary arteries. So blood that's going into the right atrium is going to come from drainage from the superior vena cava, inferior vena cava, the coronary sinus, and the anterior cardiac vein. That blood is then going to go into the right ventricle, through the pulmonary trunk, into the pulmonary arteries, become oxygenated at the respiratory membrane, and then go back into the pulmonary veins to the left atrium, where it will go into the right ventricle via the bicuspid valve, and then through another contraction where we get that second dub of the lub-dub sound. Blood will then propel itself through the aorta via the aortic semilunar valve into the ascending aorta, thoracic aorta, abdominal aorta, where it will then provide blood to all of the internal organs, as well as 2/3 of the body's blood to the lower extremities of the body. That's the heart.